Gonorrhea. Just hearing that word probably makes you cringe a little, right? But here's the crazy part. Millions of people get it every year and most don't even know. What happens if you get it? Can you get it from kissing? And what about oral or anal sex? Today I'm breaking it all down. No fluff, just straight facts. Let's go. What is gonorrhea? All right, first things first, what is gonorrhea? Gonorrhea is a sexually transmitted infection caused by a bacteria called Neisseria gonorrhoeae. This bacteria is sneaky. It loves to infect warm, moist areas like your genitals, throat, rectum, and even eyes. Yeah, seriously. And it's a big deal. According to the World Health Organization, WHO, over 82 million new cases happen worldwide every year. That means someone is getting gonorrhea every second. Wild, right? How do you get it? Now, let's talk about how this actually happens, because trust me, there are a lot of myths out there. Ways you can get gonorrhea: vaginal sex with an infected partner, oral sex. Yes, you can get it in your throat. Anal sex, it can infect the rectum too, from mother to baby during childbirth. Ways you can't get gonorrhea: sharing a toilet, hugging or holding hands, sharing food or drinks, using the same towel or bed sheet. So no, bro, you're not getting gonorrhea from a public toilet seat. That's a straight up myth. What are the symptoms? Here's where things get scary. Gonorrhea doesn't always show symptoms. That means you could have it and not even know. But if you do get symptoms, here to look out for. Symptoms in men: painful urination, feels like peeing fire. White, yellow, or green discharge from the penis, swollen or painful testicles. This can get serious. Symptoms in women: unusual vaginal discharge, often yellow or greenish, pain during urination, lower abdominal pain, bleeding between periods even when you're not on your cycle. Symptoms in the throat: oral gonorrhea, sore throat that won't go away, redness and irritation, sometimes no symptoms at all. Symptoms in the rectum: anal gonorrhea, pain or discomfort when pooping, itching or discharge from the anus, bleeding. If you notice any of these signs, you gotta get checked ASAP. What happens if you have oral or anal sex? A lot of people think gonorrhea is just a genital thing, but nope. It can infect your throat and your butt too. Let's break it down. Oral sex and gonorrhea. If you receive oral sex from someone with gonorrhea, you can get it in your genitals. If you give oral sex to someone infected, you can get gonorrhea in your throat. Throat gonorrhea often has no symptoms, so you might have it without knowing. Anal sex and gonorrhea. Gonorrhea in the rectum can cause itching, discomfort, and even discharge. Some people don't feel anything at all, but they can still pass it on. What if there's blood or sweat? Can you get it? All right, let's clear up some more myths. Blood. If there's contact with infected blood, like from open sores or menstrual blood, the risk goes up, but it's not the main way gonorrhea spreads. Sweat. Nope. Gonorrhea does not spread through sweat. It needs sexual fluids like semen or vaginal discharge. What about kissing? Super rare, but possible. If someone has a gonorrhea infection in their throat, deep kissing might spread it, but it's not common. If you're kissing someone with throat gonorrhea, there's a small chance, but other STIs like herpes or mono are much more likely to spread this way. What is the treatment? Can it be cured? Good news, gonorrhea is 100% curable, but there's a catch. How it's treated. Antibiotics, usually a single shot plus pills. But here's the problem. Gonorrhea is getting resistant to antibiotics. This means in the future, it could become harder to treat. Important. If you get treated, your partner need treatment too, or you'll just pass it back and forth. Always finish your antibiotics. Don't stop early, even if you feel better. What happens if you don't treat it? Serious complications. Ignoring gonorrhea is, if you don't idea. If you don't treat it, here's what can happen. For women, it can lead to pelvic inflammatory disease, PID, which can cause infertility, increased risk of ectopic pregnancy, which is life-threatening. For men, can cause painful swelling in the testicles, called epididymitis. In rare cases, it can lead to infertility. For everyone, if gonorrhea gets into the bloodstream, it can cause joint pain, fever, and skin rashes. This is called disseminated gonococcal infection, DGI, and it's life-threatening. How to stay safe. So, what's the takeaway? Simple. Use protection. Condoms and dental dams help. Get tested. Don't wait for symptoms. Don't ignore it. If you test positive, get treated ASAP. And that's everything you need to know about gonorrhea. If you found this helpful, hit that like and subscribe button and drop your questions in the comments. Stay safe, and I'll catch you in the next one.